This video is of a 30-year-old black male with absolute glaucoma in right eye and left eye pressure was 40 with CDR 0.8. Gonioscopically the angles were open with excessive pigmentation in the angle, so I decided to do TCTCF in this patient. As you can see, I'm using 300 micron Fugo tip, and here the conjunctiva was subconjunctival tissue was also pretty thick, so I made a slightly larger opening, and now as you can see that there's a gush of aqueous coming out from the posterior chamber, and you can see there is a rise of conjunctiva or bleb formation right there under my eyes, and I will inject mitomycin C through the same opening in the conjunctiva. It's a diluted mitomycin C, 0.002 milligram percent, and after that I will close it with 110 silk suture. And next morning his pressure came down to 8 millimeter of mercury, and the patient was quite happy. I prefer this technique here because these patients, they come from far places, and it's very difficult for them to come for follow-ups. Initially, when I never had this Fugo blade available, I used to do trabeculectomies in these patients, and I don't know how many of them were closed later, or those filtration failures later on, because most of them were lost on the follow-ups. But here, those patients who come for follow-up and I see their functioning TCTCF filtration tracts and pressures are well controlled, and it's a least traumatic surgery. So I'm very happy with this technique. Thank you. As you can see, the surgery is over. Thank you very much for your attention.